everyone, my name is Josue Acosta and my teaching topic today is personal protective equipment shortages and temporary solutions. So we all know the current state of the world. So we all know that COVID-19 is a huge pandemic that hit us all by surprise. And with it have come a lot of consequences and a lot of things that we never thought we'd face. One of those situations is a shortage in PPE. And now this shortage of PPE is actually a huge threat to healthcare workers. We all know how important it is to have PPE with us. We all know how important it is to use PPE with patients that are infected with any infectious process. We all know that it helps with and it contributes to a decrease in cross-contamination between those patients. And so PPE is a huge part of our lives as healthcare workers. Any kind of impact to the supply is an impact to our ability to give healthcare and patient safety. So we all know right now that respirators, gloves, face shields, gowns, and hand sanitizers are all actually in low supplies. And as we know, these are all things that are essential for us to provide good patient care. At recent estimates delivered by the New England Journal of Medicine actually show that the need for respirators and surgical masks actually far surpasses the supply that we have currently. And so if things keep going like this, it's going to be kind of tough. We all know also the importance of PPE. Like I said earlier, we all needed to deal with these patients and to really keep infection under control. PPE is extremely important in reducing the exposure to hazards and infectious diseases as per the CDC. And with the use of PPE, there are some established uses and guidelines that we're all very familiar with, such as we know that PPE is known to be disposable and only one use only. So the practice until now has been to really just use one face mask and dispose of it, and then use another one when seeing the same patient. We also know that new PPE, like I said, is used with every new contact with a patient. It was never needed to keep the same mask or anything. What we're familiar with is to use one and throw it away. But with this situation right now with COVID-19 and the shortages, some of these things have to change. With the shortages, we need to come up with contingency plans, strategies, and goals. One of the plans, the CDC has actually done some research, and they have established some guidelines to allow reuse of select PPE, not all of it, because not all of it is reusable. But it has been established and suggested by the CDC. Some of these strategies are to allow only essential contact with the patient, this being only essential personnel to come in contact with the patient, no visitors or anything like that, and really only go into the room if you really, really need to. Another thing is the extended use of masks throughout the shift, and the reuse of masks in the following days. These strategies are so that we can decrease the exhaustive use of PPE, so that we can decrease the burden of suppliers and allow them time to resupply, and to prevent a complete outage of PPE. Now, one of the main PPEs that we're facing a shortage on are the face masks. These are face masks and respirators, actually. We're going through them so fast that we're not allowed to keep up with it, and it's posing a huge health risk to our healthcare workers. Now, we're going to talk about two methods here. We're going to talk about extended use and the reuse of face masks. And these are very similar, but they're kind of different in their own regard. So extended use is when you're wearing the same face mask throughout the shift for close encounters with different patients. So now this means that you're not taking off the face mask at all. You're using that same face mask throughout the whole day and trying to touch it as minimally as possible. For this, you don't want to remove the face mask until the shift is complete, but you do want to discard it if it is soiled, damaged, or hard to breathe in. Now, the main thing about extended use is that you don't want to throw that face mask away if you don't need to. You want to use it throughout the whole shift and use it with as many patients as possible. I know it doesn't sound very cleanly, but that's a proper way to keep the PPE that you're using and to not face a shortage. So you do want to discard it though in these cases. Every time you go up to try to adjust your face mask, you want to make sure that you do hand hygiene, or every time you touch your face, hand hygiene. Now reusing the face mask, this is when you wear and remove the same face mask for multiple patient encounters throughout the day. So this is when you see a patient, automatically leave the room, take it off, and then put it on for the next patient. And you do this not only for that day, but oftentimes for multiple days after that, the same face mask use. Preferably, you do want to make it be a new mask every day, but as the shortages keep getting worse and worse, you might need to use that same face mask for different days. So for this, only masks with the ear loops work. The masks that tie around the back kind of don't work too well with this, because to take those off, you do have to often tear through them since you can't really undo the knots, and this makes it not reusable. Now, a way to store these face masks in a cleanly manner are to take the outside of the face mask and fold it in on itself. For this is to allow minimal contact with the infected part of the face mask with anything else. And you want to store it in a paper bag or a breathable container. So a sealable paper bag or a breathable container as per CDC guidelines, to maintain it away from anything else and maintain the infectious diseases only within that bag, and discard if soiled. And now these are all strategies that we can use to really make our part or do our part with the shortage of PPE, and they're all suggested by the CDC. Now this is a point in time in my PowerPoint where I ask you guys questions, and usually I'd go ahead and give you guys chocolate or anything like that, but because of the current circumstances, I obviously can't do that. So if you answer these right, just go ahead and buy yourself a chocolate or something. So the first question is, when should you dispose of your mask? And the answer to this is when it's soiled, or when it's torn, or when it's hard to breathe in. The second one is, what is extended use? Now, extended use is when you keep the same mask on throughout your day and try to touch it as minimally as possible. What is considered reuse? So reuse, or the act of reusing your face mask, is when you use that same face mask throughout, like for the day and for other days, but you want to be taking it off and storing it properly. And now the last one is true or false. Reusing PPE is an appropriate way to conserve PPE. Yes, it is. This is what we're going to need to be doing in order to conserve PPE in the following months. These are my references. I used the CDC and the National New England Journal. Thank you so much for watching. This is my presentation.